Thank you, and thank you all for sharing this lovely autumnal afternoon with me here. This quote, which is attributed to Sir William Osler, the founder of modern medicine, actually goes back a few centuries earlier to the Hebrew sage Maimonides. It is more important to know what sort of patient has a disease than what disease a patient has. So integrative cancer care, in my mind, is the rational, evidence-informed combination of conventional therapy with complementary interventions into an individualized therapeutic regimen that addresses the whole person, body, mind, and spirit, with cancer. And you notice the italicized word evidence-informed. Modern medicine today is strictly evidence-based, and particularly oncology, which I practiced for 38 years at San Francisco General, because we deal with a serious disease and we use complex, often toxic interventions. We want data from randomized placebo-controlled clinical trials to know that what we're doing actually works. But when I tell a patient they should eat more broccoli and blueberries, how do we do a randomized placebo-controlled trial on that? So much of what we do, particularly with nutrition, is evidence-informed. Integrative oncology predominantly provides patient relationship-centered care with the patient in the center. Integrates, again, conventional and complementary methods of treatment and prevention, aiming to activate the body's innate healing response. More and more we hear about immunotherapy unleashing the body's immune response to fight off cancer. Well, that's sort of what we're trying to do as well, using non-pharmaceutical interventions to do so, using natural, less invasive interventions whenever possible. Integrative oncology engages the mind, body, spirit, and the community. Encourages providers as well to model healthy lifestyles for their patients. So in the days when I would see patients live in clinic, I would be drinking my green tea, even though it's against Cal OSHA to have food in the exam room, but I wanted to demonstrate that I do drink 4 cups of green tea every morning. Focusing attention on lifestyle choices for disease prevention and maintenance of health, and maintaining that healing is always possible, even when curing is not. So who are the patients that I see? I don't see many people that are looking for an alternative to conventional cancer therapy, because fortunately we've trained the front desk staff and now the contact center, whatever that is, to know that I am not providing alternative therapies. I'm an integrative oncologist. So, I've been practicing oncology now for 42 years, and I know what works and what doesn't, and that there are no real alternatives to conventional care. Mostly what I see are patients who are seeking complementary therapies while they're undergoing conventional cancer therapy, to either mitigate the symptoms of cancer or its treatment, or to help prolong their remission. The other largest subset of patients I see are those who have completed their treatment, possibly are disease-free, and they're seeking optimal survivorship care. Again, similar to not being able to provide any alternatives, I don't really have salvage therapies when people run out of options. And again, we've now trained an integrative palliative care specialist, so I don't see many patients who are seeking integrative end-of-life care. So what are my goals when I see a patient at the Osher Center on their first visit? When you have the diagnosis, you have cancer, the locus of control has been ripped out from underneath you, and you're now at the mercy of the surgeon, the radiation oncologist, the medical oncologist, and the chemotherapy nurse. And giving back a sense of control is really my main goal. Inflammation, we now know, is probably the major cause of degenerative disease of aging, dementia, heart disease, and cancer. And by decreasing inflammation, again, by natural interventions that we'll talk about, we allow the body's immune system to kick in the fight against cancer. So those are very linked, inflammation and immunity. In the old days, I used to ask all my new patients, tell me your story. But we get graded by patients on these Press Ganey scores, and my lowest score was always doctor knew my history. I asked to tell me your story because I wanted to know how cancer impacted you, And I get that better if I ask that question, but I don't ask it anymore. Now I tell the patient their story. But we had a nurse once review 150 patient charts, and she said, gee, so many of your patients think stress caused their cancer. I don't think stress in and of itself can cause cancer, but stress is not good for cancer or anything else for that matter. Stress is adrenaline or epinephrine, which kills the lymphocytes, the building block cell of the immune system, and stress is cortisol, a steroid hormone, which is an immune suppressant. So decreasing stress is important. And as we heard from the last speaker, hope, increasing hope. Many a patient leaves an initial consultation with me and says, gee, Dr. Abrams, you're the first person that's given me any hope. And it's not like I've said, you don't have cancer, you're not going to die. It's just that I've given people things that they can do. And we saw from the last speaker that hope is associated with better outcomes. So what are those things that we can do to increase an individual's sense of control? Number one, as we heard, weight is important, especially for postmenopausal estrogen receptor positive breast cancer. 2/3 of the United States is now overweight or obese, and we believe that maybe 40% of all malignancies are associated to overweight. And you control weight by altering your diet and increasing physical activity. I then discuss appropriate supplement use, and with regards to stress, the breath is really the link between the mind and the body. Because before I mentioned it, everybody was breathing autonomically. We don't think about it. But now that I'm talking about it, you're aware that you can control the rate of your inspiration and expiration, as well as the depth of your inspiration and expiration. And that is the link between hypnosis, yoga, meditation. Very rarely does a patient come to see me alone, and I realize that cancer never really affects just one person. So I ask patients to connect with the family and friends that often come with them to a visit. And then spirituality and religion, I think, are also things that people need to tune back into. When I see patients at the Osher Center, I'm not treating their cancer. So I tell patients that cancer is like a weed, and someone else is taking care of your weed, and it's my job to work with the garden and make your soil as inhospitable as possible to growth and spread of the weed. So I do that by looking to see how you fertilize your garden, that is what you eat and what supplements you take. And then I launch into a 20-minute discussion about nutrition and cancer. And basically I use the American Institute for Cancer Research, World Cancer Research Fund guidelines for cancer risk reduction. And you'll see that number 10 at the bottom says, after a cancer diagnosis, follow the 9 guidelines above. So that's why it makes sense for me to talk about these guidelines even with people who already have a diagnosis of cancer. So again, number 1 is to be a healthy weight, and 2/3 of the United States is overweight or obese. This map shows us the prevalence of obesity. The darker the color, the more likely, or the higher the incidence of obesity. Obesity is a body mass index greater than 30. Overweight is body mass index between 25 and 30. So I do calculate everybody's body mass index that I see. You can see that Colorado and California and some of the New England states are pretty good. Colorado used to have the lowest rate, but now it looks like the District of Columbia, surprisingly, is the leanest people in the country. The CDC estimates, again, that overweight or obesity may be associated with 40% of all cancer in the US, over 50% of cancer in women, 1/4 of the cancer in men, and 2/3 of the cancer in senior citizens. So they also estimate, the American Institute for Cancer Research estimates that obesity-related excesses of these 7 cancers account for 115,000 preventable deaths in the United States each year. And you notice that the largest N or number is breast cancer, 33,000. Even though it's overweight or obesity is associated with less than 20% of all breast cancer, because it's such a common diagnosis, it's the largest number. Notice that 50% of endometrial cancer is felt to be associated with overweight or obesity. And the rest of the obesity-related malignancies are pretty much along the gastrointestinal tract, although interestingly, A quarter of kidney cancer is also related to overweight or obesity for reasons that are unclear. And again, of interest, the possible decreased risk, that obesity decreases the risk of premenopausal breast cancer. But I don't think that's any reason that we should encourage younger women to be obese. How is it that body fat increases the risk of cancer? Well, as you know, for the estrogen-responsive tumors, fat does make estrogen. And that's what drives the ER-positive postmenopausal breast cancer as well as the endometrial cancer. And body fat itself secretes chemicals that promote inflammation. And again, when you have increased inflammation, you have decreased immunity. And this we saw in the COVID epidemic at the beginning when thousands and hundreds of thousands of people were dying, that many of them were obese and felt to have decreased immune response to the virus. I think perhaps the most important issue here is too much body fat triggers insulin resistance, which means that the body has to increase production of insulin and insulin-like growth factor. And both of those promote inflammation, and the growth factor is a growth factor for cancer cells as well, to the point where a study was done looking at blockade of insulin-like growth factor 1 receptor as a treatment for women with postmenopausal estrogen receptor positive breast cancer. So how do we maintain or become a healthy weight? Physical activity, again, as the last speaker alluded to, is very important. We believe that physical activity decreases the risk of breast, prostate, and colon cancer, and patients with those three cancers who are physically active have much better outcomes. And that was demonstrated nicely in this meta-analysis of 16 studies of breast cancer survivors and 7 colorectal cancer studies that included 50,000 cancer survivors. The most active breast cancer survivors lowered their rate of death from breast cancer about 30% and all causes 50%, similar for colorectal cancer. So survivors reporting an increase in their activity after they'd been diagnosed also lowered their risk of death about 40% compared to those who did not. So it's never too late. And what do I mean by exercise? How much exercise do you need to do? Well, the exercise physical activity leadership suggests 150 minutes a week. That comes out to about 30 minutes of activity 5 days a week. And a recent study showed that people who clump those 150 minutes to the weekend warriors who only exercise on weekends still have the same benefit as people who spread it out all during the course of the week. So I think exercise should be aerobic, that is running, jogging, swimming, biking, something that increases your heart rate and makes you sweat, and that also burns calories. In addition, I think we need to have a component of resistance, weightlifting, bands, isometrics, because that keeps our muscles toned and our bones mineralized. And as we know, many cancers, particularly breast cancer, likes to travel to bone. So I think having strong bones is very important. And then this graph shows you the benefits of these exercises, and particularly the benefits of combining both aerobic and resistance exercise. In a study of lung cancer patients, survivors, they all wished that their oncologist had told them to do physical activity. I see more and more in the charts that I see from my colleagues at UCSF Cancer Center, particularly the breast oncologists, are encouraging women to do more physical activity. A survey of Canadian oncologists showed that 2/3 agreed that physical activity was safe and beneficial, but less than 50% ever even recommended it. And if an oncologist recommends physical activity, it results in an increase of 60 minutes a week more of vigorous activity, and that certainly can impact survival. The third recommendation now is to limit consumption of fast foods, particularly processed foods high in added sugar, low in fiber, or high in fat. And that replaced the previous number 3 recommendation, which was avoid sugary drinks. But I think it's interesting that they've actually shouted out fast foods. And I like this quote from the American Institute for Cancer Research: processed foods high in fat, starches, or sugars embody a cluster of characteristics that encourage excess energy consumption, i.e. eating too much. For example, by being highly palatable, high in energy, affordable, easy to access, and convenient to store. And when I used to give a lecture to the third-year medical students at San Francisco General, as you know, San Francisco General, a hospital that predominantly takes care of socioeconomically disadvantaged populations, the students would raise their hand at the end and say, what about our patients here? And I say, it's not my fault that my organic apple that I eat every day costs more than a double cheeseburger, French fries, and a shake. You know, we subsidize the wrong foods in this country. So what about ultra-processed foods? I read my colleague Robert Lustig's book, Metabolical. Robert is our pediatric endocrinologist who fights the war on childhood obesity and sugar. And in the book Metabolical, he blames the deterioration of our health as a nation over the last 50 years to overconsumption of processed and ultra-processed foods. So I tell my patients, and I hold up my apple, eat something that you recognize as a real food. The study of 200,000 people in the United Kingdom, their mean ultra-processed food consumption was 23% of their total dietary calories. In the United States, you know what it is? 55%. And in children under the age of 18, it's up to 65% calories coming from ultra-processed foods. During a median follow-up of 10 years, 16,000 of these patients developed cancer, and there were 4,000 cancer deaths. Every 10% increase in ultra-processed food consumption was associated with a 2% increase in overall cancer, and specifically ovarian cancer, 20%. Every 10% increase in ultra-processed food consumption was associated with an increased risk of overall death, and death from ovarian and breast cancer increased 16%. So ultra-processed foods are no. And then a systematic review looked at 8 retrospective case control studies and 3 prospective cohort studies. 9 of the 11 reported a significant positive association between ultra-processed food intake and all the assessed cancers except prostate cancer after adjusting for obesity and total caloric intake. And again, in this study, a 10% increase in ultra-processed food was associated with an increased risk of breast cancer, 11% increase. So again, the available evidence suggests a consistent association between intake of ultra-processed foods and the risk of overall and several cancers. And as you may know, there's this big, why is this happening question about young people being diagnosed with more colon cancer. Well, it's what they eat. And finally, a study was just reported, yes, in women under the age of 50, increased ultra-processed foods leads to increased diagnoses of pre-malignant polyps. So, I mean, I sent it to Robert Lustig, who was vacationing in Maui, and he quickly sent back, duh, you know. The guideline that they reversed, or they ripped out ultra-processed foods from, previously said avoid sugary drinks and other foods high in fat, starch, yada, yada. So they changed it this year, and it now says avoid sugar-sweetened beverages, which I challenge them on because sugary drinks are the issue. So here's, the French do a lot of these epidemiologic reviews of cancer and nutrition. And they looked at 100,000 people and evaluated consumption of sugary drinks, including 100% fruit juice, because 100% fruit juice is the most common sugary drink consumed in France. And again, these patients, 100,000 people developed cancer, and breast cancer developed in 693, prostate and colorectal. And they found a positive association between sugary drink consumption and overall cancer. For every 100 cc a day increase, it increased 18%. Breast cancer increased 22%. No association for prostate cancer. And they also found a positive association between 100% fruit juice. So Artificially sweetened beverages, they found no increased risk. So when they first unveiled avoid sugary drinks in 2007, I actually went to the microphone because I was at the meeting in Bethesda. And I said, there are sugary drinks and there are sugary drinks. You can drink a Coca-Cola, God forbid, or Tropicana fruit punch, which is probably glucose and high fructose corn syrup, or you can squeeze 3 oranges in the morning. And the response from the podium was energetically, they're all the same. Because if you eat the orange, the fiber slows down the absorption of sugar into the bloodstream. If you squeeze the sugar away from the fiber, it's like drinking a soft drink. Why is that bad? When the body sees that sugar, it responds with insulin and insulin-like growth factor, both of which promote inflammation, and the growth factor is a growth factor for cancer cells as well. Doesn't mean I don't squeeze my 3 oranges. I used to do it every day. Now I do 2 oranges once a week. And in Australia, they rank food in the supermarket for the consumer. And they recently dropped fruit juice from 5 stars to 2 stars, ranking it below Diet Cola, which I never would recommend that anybody drink. So sugar is the #1 no. And my patients always say, well, should I drink this juice to cure my cancer? And I say, no, it's sugar and it doesn't cure cancer. So the positive recommendation is to eat more of a variety of vegetables, fruits, whole grains, and legumes. I'm a big fan on phytoestrogens, even for women with breast cancer, estrogen receptor positive. We believe that soy, for example, decreases the risk of breast cancer, and soy, as I'll show you in a moment, decreases the risk of breast cancer recurrence. Flaxseed also has some phytoestrogens as well as some omega-3 fatty acids. My favorites, however, are the cruciferous vegetables. Flowers grow in the shape of a cross. So broccoli, cauliflower, and Brussels sprouts jump to mind. But there are also cruciferous roots and green leafies: cabbage, kale, collard green, bok choy, and arugula. These all contain a chemical so potent at reducing the risk of cancer, sulforaphane, that we started to look at it as chemotherapy. And they also contain something called DIM, which changes a woman's estrogen from the type that fuels estrogen receptor positive cancer to the type that doesn't. So I say we can never eat enough cruciferous vegetables, and I eat broccoli, tofu, and rice for either breakfast or lunch. Now, DIM and sulforaphane and indole-3-carbinol are all available as supplements, but I'm a bit of a believer in Paracelsus, who was a physician who spanned alchemy and medicine in the Renaissance, who said there's poison in everything. The difference between a remedy and a poison is the dose. So I say eat broccoli and don't take DIM supplements. Season with ginger, garlic, onions, and turmeric. I mentioned green tea, second only to cruciferous vegetables in its cancer risk-reducing capacity. And I like the omega-3 fatty acids found in deep cold water fish. So I mentioned soy. Kaiser did the large life after cancer epidemiology study, looking at 2,000 women with breast cancer survivors and followed them for 6 years. And they found that soy intake at levels comparable to those consumed in the Asian population, that is 1 portion of a whole soy food a day, reduced the risk of recurrence in women, even those treated with tamoxifen. Does not appear to negate the effects of tamoxifen. This study result was reproduced by the Shanghai Breast Cancer Survival Study, also noting a 30% decrease in recurrence and mortality, and the Women's Healthy Eating and Lifestyle also confirmed the benefits of soy. So it's one of the biggest misconceptions in my mind with women with breast cancer, that they need to avoid soy because it's a plant estrogen, but it's actually beneficial. Nuts. I got a pocket full of them right here for a little snack. We're all phobic about nuts because, ooh, they're fat and they're salt, but they happen to be good for you. Not only do they decrease the risk of breast cancer, but they decrease the risk of colorectal cancer. So in this study, regular nut consumers, women with breast cancer, had higher overall survival and disease-free survival compared to those who didn't. So promoting this modifiable lifestyle factor should be emphasized in breast cancer survivor guidelines. So eat nuts, and it doesn't matter whether they're peanuts or tree nuts, nuts are good. Another guideline that they changed, unfortunately, limit consumption of red and processed meats. It now says limit consumption of red meat and avoid processed meats. So this is the linear relationship between red meat intake and the risk of colorectal cancer in women. And this is an old chart. New Zealand and the United States have now been replaced by the Czech Republic and Japan at the top because of westernization of their dietary habits. Processed meats are considered a class 1 carcinogen by the World Health Organization. Bacon, salami, bologna, hot dog, sausage, anything you put on a pizza. So I was on a webinar with the AICR, the American Institute for Cancer Research, and I said, you know, you changed 2 guidelines from 2007 to 2018. They update them every 10 years after reviewing all the published information. I said, you changed avoid sugary drinks to avoid sugar-sweetened beverages. And I just showed you that was incorrect. And I said, you changed avoid processed meats to limit consumption of red and processed meats. And I said, why'd you do that? And they said, we wanted to have people meet us halfway. And I said, yeah, but you're increasing people's risk of cancer by not saying the truth that sugary drinks and processed meats should be avoided. What's the matter with red meat? Well, this is a slide from David Servan-Schreiber, may he rest in peace, my friend who wrote the book Anti-Cancer, who was French, so he spelled pork differently. But omega-6 fatty acids are necessary when we cut ourselves to have our platelets clot and to have the coagulation cascade occur, inflammation, if you will. So we need omega-6, and omega-3s are anti-inflammatory and they lyse platelet clots. But our food supply has become way dominantly omega-6 as opposed to omega-3 fatty acids, and those promote inflammation. But in addition to the omega-6 to omega-3 out of balance, red meat has iron, and iron feeds cancer. How many patients do I see who say, oh, I'm anemic from my chemotherapy, I started an iron supplement? I say, please stop your iron supplement. If you're not iron deficient, iron feeds cancer, and that's one of the problems with red meat. In addition, the processed meats have nitrates, which are carcinogenic, and we live in a culture where we like to burn flesh, i.e. barbecue. And when you barbecue, you create heterocyclic amines, which also are associated with colon cancer. I'll have the half-pound double deluxe bacon steer burger, please. You want chemotherapy with that? So I'm not saying we have to be vegan or vegetarian. In fact, there is no culture that's had vegan as their diet that has existed or persisted. Seventh-day Adventists are usually some type of a vegetarian. And they did this study looking at vegetarian patterns and the risk of colorectal cancer in Seventh-day Adventists. So the vegetarians compared to non-vegetarians had a decreased risk of 22% of their colorectal cancer. Vegans, it was only decreased 16%. The largest decrease was in the pesco-vegetarians, those people who ate fish in addition to their vegetables. So I think it's important to eat some animal products personally. Now, we heard from the last speaker as well that alcohol is something that one can avoid if they want to deal with decreasing breast cancer risk. And the guideline in 2007 changed. In 2018, they changed the 2007 guideline, which I was happy about this one, because in 2007, it said, if consumed at all, limit to 2 a day for men and 1 a day for women. Well, if at all, 2 a day. As somebody who reached an age where alcohol does not agree with me at all, that was very hard to sort of rationalize. You can drink up to 2 drinks a day? No. So they changed it, not because of me. In 2018, for cancer prevention, it's best not to drink alcohol. We believe, and this is from the American Society of Clinical Oncology, the International Agency for Research on Cancer has classified alcohol as a group 1 carcinogen. No doubt about it. We now believe that 6% of all cancer is related to alcohol, and the leading cause of death from alcohol in people over the age of 50 is now cancer. And you can see for risk of estrogen receptor positive breast cancer increases dramatically by the number of alcoholic beverages consumed. This is from Michael Gregor, who does nutritionfacts.org, a militant vegan. If even light drinking can cause cancer, why don't doctors warn their patients about it? And the New England Journal had an article suggesting that this should be put on all bottles of alcohol. So fertilizing the garden is not only what you eat, but what supplements you take. And very frequently, patients come in with a bag full of supplements that have been recommended by their next-door neighbor, their aunt in Cleveland, or the mailman's sister-in-law, and they said, is it okay to take this? And the real question that they're asking is will this interfere with my cancer treatment? And there are two ways, really, that the interference can occur, either by interacting with the liver system that metabolizes pharmaceuticals, or by the so-called antioxidant effect. So these are some of the anti-cancer drugs that are exquisitely metabolized by the cytochrome P450, 3A4 isoform, and those are some botanicals that may be of concern. So if you induce the enzyme, what you're doing is allowing the pharmaceuticals to be broken down at a more rapid rate than the oncologist thinks. So St. John's wort, which is used for people with mild depression, is the biggest no in the botanicals because it does induce the breakdown of the anti-cancer drugs metabolized by the same enzyme. Ginkgo, on the other hand, inhibits the enzyme. So if people are taking ginkgo while they're getting those drugs, it might increase the concentration and hence the toxicity. So that's the drug-drug interaction. Oxygen exists as two molecules linked together. That's how we breathe, that's how we live. But when those oxygen molecules separate, they create so-called reactive oxygen species that knock into our DNA, causing damage, leading to aging or cancer. Antioxidants take those free radicals or reactive oxygen species out of circulation so they don't do damage. Well, it turns out radiation therapy works by creating those same free radicals, and also some chemotherapy works that way as well. So do you want to take antioxidant supplements when you're getting either radiation or strongly oxidative chemotherapy? And that includes the platinums, cyclophosphamide, and the rubicins. And these are some of the useful antioxidants that patients might be wanting to take. So that is a problem, and I definitely recommend that patients getting radiation avoid antioxidant supplements, but it's fine to eat blueberries, because when it comes down to that beam of radiation versus the blueberry, you know who's going to win. So my advice, if we're going to cure, the goal of our treatment is to cure, or if it's adjuvant treatment after surgery, let's delay the antioxidants until the end of treatment. I know in the old days, my colleagues across the street in the breast cancer group used to tell their patients, stop your antioxidants the day before, the day of, and the day after your chemo. Well, that doesn't really take into account the half-life of the chemo or the antioxidant. If the goal is palliation and we're not really attempting to cure the cancer, then if the person feels empowered using antioxidants during treatment, then so be it. So the supplements that I recommend are not many. I check, the only blood test I do at the Osher Center is a 25-hydroxy vitamin D level. Vitamin D, we think about bones, rickets and osteopenia and osteoporosis. But vitamin D is also important for our immunity. When COVID started, I sent my buddy Tony Fauci a message saying, Tony, vitamin D. And it turned out that most of those obese people who died were vitamin D deficient. Well, you're vitamin D deficient if you're obese, if you're over 50, or if you're over-pigmented or more pigmented than Caucasian. So I'd say 80% of the people that I see are vitamin D deficient. And again, low vitamin D puts you at greater risk for cancer, and people with cancer whose vitamin D levels are low have been shown in numerous studies to have poorer outcomes than people whose vitamin D levels are normal. Vitamin D is fat soluble, so it's best taken as a gel bead or a liquid and not as a white powder complex to calcium. But I do believe calcium and magnesium are important for bone health as well and for decreasing the risk of colorectal cancer. And I talk to patients about dairy not being the best thing to consume, and that is our most rich source of calcium in the diet. So that's why I often recommend people take a calcium magnesium supplement, and if it has zinc in it, that's also okay. Omega-3s, not everybody's eating deep cold water fish every day, salmon, black cod, albacore, tuna, herring, mackerel, or sardines, so I say take an omega-3 supplement. I'm a big fan of medicinal mushrooms, as you heard. Turmeric, a potent anti-inflammatory, and for patients who have had chemo, which I consider to be a potent antibiotic, I often recommend taking a probiotic, particularly a refrigerated probiotic. So most of the medicinal mushrooms work as nonspecific immune stimulants, enhancing the host response. Some also may have direct cell-killing effects. And most of the clinical trials looking at the mushrooms have been done in Japan and China, so we tend to be a little xenophobic with regards to research acceptance, so many of my colleagues don't believe that mushrooms have any benefit. The white button mushroom, shown on top, agaricus, has to be cooked. All mushrooms must be cooked. Slicing white button mushrooms and throw them in a salad is a no. White button mushrooms have a cancer-causing compound in them. White buttons, their brown cousins, the crimini, and their giant cousins, the portobello, may have some aromatase inhibitor activity, so good for you, but must be cooked. Maitake is a good immune modulator, also an edible mushroom, as is shiitake. Both of those enhance the immune system. Lion's mane has become very popular lately. It looks like a big snowball or a lion's mane, and it seems to increase brain-derived nerve growth factor. So for people who have chemo brain or peripheral neuropathy, I often recommend lion's mane. Reishi or lingzhi is the mushroom of immortality in China. Again, immunomodulates and may have some direct anti-cancer activity. My favorite mushroom that I recommend to all patients is turkey tail, or Trametes versicolor. This, again, immunomodulates. The cell wall of the mushroom resembles the cell wall of a bacterium. So when you take the mushroom capsules, your body thinks you're being invaded by a bacteria, mounts a non-specific immune response to fight off the bacteria that we hope will also fight off cancer. I don't recommend immune-stimulating mushrooms to patients on the new immunotherapy. It's just me. It's just intuitive. There's no data. But I don't want the immune-enhancing effect of the mushrooms to interfere with the potentially much more likely to be beneficial therapeutic immune effect of the immunotherapy. Cordyceps is energizing, oxygenating. So for my patients who suffer from fatigue, cordyceps is one of my go-tos. I'm also a big fan of cannabis. This is a study of women with breast cancer responding to a survey. 612, 42% used cannabis for medicinal reasons, mostly felt that it was very useful for treating pain, insomnia, anxiety, stress, and nausea and vomiting. So I'm a big fan of cannabis. I think it also helps to decrease stress. As I mentioned, many of my patients thought that stress increased the risk of cancer. Well, there was a study of women with ovarian cancer who were interviewed preoperatively. Those who lacked social support and had higher levels of distress, their tumors had higher levels of vascular endothelial growth factor, which allows the tumor to make new blood vessels and become bigger. So that was the first association between a psychological factor and a cytokine involved in tumor blood vessel formation. This was a similar finding was subsequently seen in 42 patients with newly diagnosed head and neck cancer. Poor psychosocial functioning, that is depressive symptoms, stress, anxiety, and lack of social support, were significantly associated with greater VEGF expression and higher VEGF, more than 2 times likely to die than those who had lower VEGF expression. So maybe stress, as I said, is not good for cancer. So how do we manage stress? Support groups, although I have many younger cancer patients who don't like support groups because they feel threatened listening to people who are more advanced with their disease. But support groups have been shown to decrease stress. Journaling or writing down how you feel at night, disclosing your diagnosis to other people. Guided imagery, which is sort of a semi-hypnotic suggestion to go to the beach in Maui and think about your lymphocytes eating up your cancer, hypnosis, breath work. I teach my patients Andy Weil's favorite 4-7-8 breath, which is relaxing. It sort of changes the rate of your inspiration and expiration. Psychotherapy. We have mindfulness-based stress reduction program, a program developed by John Kabat-Zinn at the University of Massachusetts in Worcester. It's an 8-week course that the Osher Center offers and many other places do. Teaches you to be here in the moment, not judge your thoughts. It's very sort of like a Buddhist meditative practice. And then yoga, of course, I find to be very useful mind-body interventions. Time magazine had a story a few years ago, Can Complementary Therapies Ease Cancer Treatment Symptoms, What the Science Says, and it really focused on acupuncture. I believe in a past life I must have been a practitioner of traditional Chinese medicine because it speaks very loudly to me, balancing yin and yang and the qi and the energy. And in 1994-97, the Institute of Medicine or the National Institutes of Health had a consensus conference that concluded that acupuncture was useful for treating nausea associated with chemotherapy. Since that time, many other benefits of acupuncture have been demonstrated in cancer patients, fatigue, depression and anxiety. For women with breast cancer, the musculoskeletal symptoms that are associated with aromatase inhibitors have been shown to benefit, as have hot flashes, both in women on hormonal therapy as well as men on androgen deprivation. Acupuncture was found to be equal to venlafaxine in relief of hot flashes in women and also in men, and again for cancer-related fatigue in breast cancer. I'm a big fan. I like all of my patients, particularly those getting active cytotoxic chemotherapy, to get acupuncture concurrently. A study from China demonstrated that patients who got acupuncture during chemotherapy had much less damage to their liver, their kidney, and their bone marrow. And I think it greatly improves quality of life. So when I see my patients, I ask them if they were raised with any religious beliefs. And most people were, but they have lapsed. And then I ask, do you consider yourself spiritual? Many people ask what I mean by that, but most people can answer, and most people say yes, unless they're a lawyer or an engineer. And then I ask them 3 closing questions. What brings you joy? What are your hopes? And where does your strength come from? And I'm amazed at how articulate my patients are. One husband once said to me while I was asking his wife these questions, what is she, being interviewed for Miss America? Because it does sound like those final questions. But then I saw a woman at a conference who said, I brought my husband to you when he was very near to death. And when you asked him those 3 questions, he realized that even though he was where he was on his journey, he still had joy, hope, and strength. And that was very important, so thank you for that. I've now added a 4th question. At the listening to grand rounds from our integrative geriatric person, she said the question that she asked all of her older patients is, what matters most to you? And that sort of is what integrative medicine is about. It's not what's the matter with you, it's what matters most to you. Exploring the patient's personal determinants of healing. These are all the aspects that we look at in integrative health. And we remind ourselves that the role of the physician is to cure sometimes, heal often, and support always. And with that, I'll stop and thank you for your attention. Am I answering questions? I am answering questions. Questions, but I am wearing my hearing aids, so just let me tune them up for one moment. Hang on. So I can hear your questions unless you have a microphone.
Okay.
One sec, let me just get this functioning. Yeah.
Here I go. Hi. One side of my family, they eat one way, and the other side is like vegetarian, and they don't eat nothing, and blah, 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 blah.
Thank you.
But they have the same symptoms I have. So I want to ask this question that we always argue over the dinner table. Why are you eating that pork? Why are you eating this and that? And they have the same symptoms that I have. And one of my cousins, she has the same symptoms. I never drink, I'm 62, never drink, never smoke, never put nothing in my body wrong, but I have the cancer, and she did everything. So I'm trying to figure out the difference between you're eating this way and you still got what I got, and I'm doing it the right way, I think I am, and they're doing it another way. So what part of cancer do that play in that part of?
I don't think there's an answer to that question. But I wouldn't spend too much time and energy wondering why, because
Okay.
you've been dealt your cards and now you have to play your hand. And I think wondering why or what I do wrong or what happened, we saw the percentage of women who get breast cancer is, even without any family history, is significant. So it just happens, and you need to move forward and let go. Don't compare yourself to your relatives.
Okay.
Okay.
Hello. What's your opinion about red meat that has been grass-fed and grass-finished, not grain-finished? Does that have a different ratio of the omega fats?
I'm
And is
sorry.
it safe?
I'm sorry. My phone is now ringing, and I can't. Say it again.
What's your opinion? I've heard that red meat, lamb, and things like that are safe. They have a different ratio of the omega-3 to the omega-6 if they are grass-fed
Yeah.
and grass-finished rather than grain-finished.
Yeah.
What's your opinion?
Yeah, no,
Thank
totally.
you.
That's the problem with red meat today, is that we feed it things that it doesn't know how to make into good fat. So personally, I don't believe beef or pork are ever going to be clean, and the red meat that I'll eat is lamb, because I picture it roaming the hills of Sonoma or New Zealand and not penned up like beef and pork. That could be totally naive, but that's why I eat lamb. But grass-fed beef apparently has a much higher health index than regular beef that's fed grain.
Hello? Yes, you can hear me? Thank you. Appreciate all that you've said. I have a question relating to one of the things you mentioned, which had to do with insulin, which obviously relates to diabetes, and there's type 1, there's type 2. I'm curious, type 1 diabetics as opposed to 2, that are always involved in insulin up and down and all the effects, how does that relate to cancer when you talk about insulin as being like a
Yeah,
growth
so
hormone?
diabetics do have higher rates of cancer who use insulin. Diabetics who use metformin, interestingly, have lower rates of cancer. And that has led to metformin becoming very popular as something that people want to take when they have cancer to prevent recurrences. Watson of Watson and Crick believes that metformin kills cancer stem cells. So there are about 200 clinical trials going on adding metformin to standard cancer therapy in every different cancer type, and I'm not sure that any of those have actually demonstrated benefit yet at this point in time. But metformin is not without toxicity, and many of my patients get GI toxicities when they take metformin and they don't have diabetes. So it's not something I recommend. But
I understand.
insulin, just like I mentioned when you get those spikes, also diabetics who use insulin are at greater risk for different malignancies.
And there's no way around that. So a type 1 diabetic that has to take insulin, metformin you could have as well, but if they need to take insulin, that it's going to have a very negative effect. No way around it, huh?
I'm not an endocrinologist. I'm sure nowadays we have all these mumumabs that they probably will use to treat diabetes as opposed to insulin.
Hello, back here. So I have two questions, one about cannabis and one circling back to the beef question, but I'll start with cannabis. So you said you're an advocate. However, I've noticed on labels, like especially for THC products, there is still like a warning label that says that you could be at higher risk of cancer exposure. And so I don't know, CBD is, I feel like it's a cousin to cannabis. So if does that mean that CBD products and THC are, at risk of cancer? And the second question is, if someone was diagnosed with HER2 breast cancer, is it safe for her to eat beef?
Is it safe for them to eat meat?
Grass-fed beef,
I mean,
like red meat.
I mean, there's no difference in any, my recommendations are not aimed at the weed particularly, they're aimed at the garden and making the soil as inhospitable as possible. So it doesn't really matter if it's HER2 positive or HER2 negative. Cannabis does not cause cancer. I was on the 16-person committee of the National Academy of Science, Engineering, and Medicine that reviewed 10,000 articles in 2016 and came out with the book, The Health Effects of Cannabis and Cannabinoids. And we concluded that there's no evidence of increased risk of lung or head and neck cancers in people using cannabis. Those are two tobacco-related malignancies. In fact, a large study from the United Kingdom showed that women who use cannabis have lower risk of kidney and bladder cancer, and men have a lower risk of prostate cancer. There was a concern that cannabis could increase the risk of testicular cancer, but we had somebody from the National Drivers Association come to us in Washington when we were having our meetings and asked them if there's increased automobile accidents in states where cannabis has been legalized. And he said there are, but if you adjust for one fact, the increase decreases or disappears. He said, who smokes cannabis? Young men. Who gets into car accidents? Young men. So similarly, who smokes cannabis? Young men. Who gets testicular cancer? Young men. So it's true, and unrelated. It's a statistical association, but it doesn't imply causation. It's like the fact that there are increased drowning deaths in months where ice cream is overconsumed. True, and unrelated.
Thank you so much.
Hello, just two quick questions. There's a lot of recipe books, cookbooks out there for people with cancer, like the Cancer Kitchen, Crispy Cancer, Medical Medium. Do you have any recommendations on any books that kind of cover everything, broadly versus like narrowing into one specific thing? And then the last question is, not all supplements are created equal. So do you have any recommendations on like tips or tricks to buy decent supplements?
So the first one was about books, and was it about cookbooks specifically or other books? So, I have a list of books that I share with patients that I see that I created over time. Of course, Rebecca Katz is a close friend, and she did the Cancer Fighting Kitchen, and I wrote the foreword to it, but many people really like that book. I love the book Foods That Fight Cancer, not the cookbook version of it, but the book by Richard Beliveau, Foods That Fight Cancer. It's really quite an elegant book. Of course, I did a textbook with Andrew Weil, Integrative Oncology, but it's really focused at healthcare providers. And the Society for Integrative Oncology is coming out this year with a book that's replacing my book because I didn't do a third edition. The last part of the question was, what again? Remind me. About supplements. Oh, supplements. Yeah, I have a consumerlabs.com prescription or subscription, and I use that, but they rank supplements, but there are also other things that you can look at the side of the bottle to make sure that it's, I forget what those labels are, but there are things that tell you that it's been approved and it seems to be good, but sometimes that doesn't work either. So Consumer Labs, I think, is pretty intense in their analyses of products, supplements. Last question?
Oh,
Last question, I'm told.
I
Who
hate
has the
to
mic?
take the last question.
Yeah. Yes, you get the last question.
It's not exactly a question. I just wanted to reinforce your suggestion of support groups. This table is a BACC support group, and by the end of the first meeting, any question of why me was gone. Yeah. Because of who else was in the session, and you just look at these people and you go, oh, it can happen to anyone. And the other thing is my doctor just told me that metformin depletes vitamin B12, so she has me taking B12.
Yeah, many things do. I mean, I have to take omeprazole chronically because I have esophageal spasm, and any antacid taken chronically, we need acid to absorb nutrients from our food, the most important of which as we age is B12. So anybody taking chronically proton pump inhibitor or chronic antacid should take B12. I'm told I need to leave, so thank you.